Welcome. I'm Alan Dow, a physician at VCU Health, and I'm here today with Perspectives on Pandemic, interviewing Dick Wenzel. Dick is a world-famous infectious disease doctor, one of our mentors, former chair of medicine, and just someone that is really a go-to people all around the world to talk about infectious disease. He's made his entire career on healthcare epidemiology and about how infections spread, so it's really great to have him here. Dick, welcome.
Thank you very much, Alan. My pleasure.
You've been such a lion of the field. You've trained so many of us, and I've had many conversations over 20 years of me being at VCU around infections and infectious control. And so as we think about that for the lay public, maybe you can just sort of lay the foundation where we are today. It's a Thursday, I think it's April 9th, and talk to us about sort of how you think about the condition of what we know about COVID at this moment.
Well, we're just learning, and there's a great deal of uncertainty, which I want to underscore. At the same time, much of that driven by the fact that our testing materials are still in need and to be used widely. So whatever numbers we have, there are some people say we should multiply them by 5 or 10, whether it's the total cases or the number of deaths. And there are about 800,000 and 4,000 deaths respectively. I've tried to take an even more conservative view, say let's just multiply by 3.75 so we don't get skeptics immediately. But we really know very little except that we're still on the upslope of the curve, I think. There's some hope in some cities that maybe we're slowing down. And some other countries, for example, China, South Korea, Singapore, look like the isolation that we put into place that has actually controlled things for them, and that's encouraging.
And I think one of the big things that's happened over the past week was this call by the CDC for everyone to begin wearing masks when they're out in public. So, with your expertise, tell us what's behind that idea of wherever you go, you need to wear a mask.
Yeah, I think there are many reasons that together I think would be compelling to use a mask, but the one that really spurred CDC on was the increasing recognition of the asymptomatic or pre-symptomatic, or you can imagine a mildly symptomatic person says this can't be COVID-19. Their roles, it turns out, may be more significant than we ever imagined in transmitting this virus. So the figures that Tony Fauci put out recently was 25% to 50% of infections could be asymptomatic or pre-symptomatic. The CDC has suggested it's closer to 25%. But the fact is, without testing, these are broad perspectives that we really need some more data on. But nevertheless, it's important. So wearing a mask means that if I'm an asymptomatic carrier, I will protect anyone near me from large droplets that I might have with a mask. Similarly, if someone else is a carrier and I'm 6 feet away or even more, my wearing a mask will protect me. That's the key driver, I think, that drove CDC for that. And there's some other reasons to think about a mask.
So it's not just protecting ourselves, but also protecting our loved one from us, which I think is an interesting point to bring to people.
No, absolutely right. The mask works probably both ways as best we can tell. And again, we really need even more data. We learned very little from prior pandemics, despite the fact that we've had them regularly now at about 10-year intervals. Never sure exactly when or how bad, but they're here. They're part of life.
Yeah, I've seen a few interesting things about spread in families, or I think there was something about family reunions. I wonder if you could talk a little bit about that concept.
Yeah, it's a great question because in some studies, up to 75% of infections in some towns are occurring within families. And then obviously, if you're in a confined environment, happen to be in a cruise ship in the era of COVID-19, it's just rampant how it moved to different passengers on that ship, including aircraft carriers with our own military. So close contact certainly seemed to be one of the triggers.
Yeah, but just to be clear, it sounds like we're not recommending masks necessarily wearing around the house, but it's the idea of how do you build that wall to keep it out of your household to begin with.
Yeah, I think that's right, Alan. So what we really want to say is if you're going out in public, you're going to go to the grocery store, hopefully spend as little time as you can there, but still protect yourself wearing a mask as soon as you get out of your own car. Again, you might be visiting the post office. You might be picking up supplies somewhere at one of the other local stores or, Kmart, something like that. Wear a mask. It's the best thing for your health that you can do, and we're limited in how much we can do. Still say at least 6 feet away from people if it's at all possible. And it's complicated because it gets crowded sometimes in stores and other places. So look at your distance, wear your mask.
Yeah, so let's dive into that because I think this is an interesting point for the public. So, world famous infectious disease doctor needs groceries. Tell me how you're going about things like grocery shopping right now.
Well, I think we're experiencing something that may persist beyond COVID. That is, I or my wife can call up the store, leave an order. They'll give us a time interval, an hour, and we plus or minus. We can pull in to a designated spot. We call to say we're here. The name is Wenzel. Pop the button. The back of the trunk lifts up. The person comes out and puts it in the trunk. I close the trunk with no other conversation, and we're off. I said this has gotten so comfortable it may persist after COVID-19, but that's what we're trying to do. Not
Yeah,
everybody has the ability, but if you have it, less contact is better.
yeah. Well, it completely depersonalizes that shopping experience. But you're right. I mean, maybe that's the evolution that we're going to see here. I'm wondering when you get those groceries home, what do you do? Do you feel comfortable bringing them in? Do you let them sit? How do you think about that process?
No, I'm compulsive, and I would say to anybody, no proof that, if you will, disinfecting the edge of any kind of container will cut down for sure, but it might. And I would say the other important link, if it makes you feel more comfortable, do it. So, I leave the bag or bags outside on a bench, and then we have a disinfectant cloth, and I can pull out the items one by one, rub the cloth over them, and then take it inside. I feel comfortable that way, and maybe I'm doing something good.
Yeah, yeah. What about things like mail or other things like that they come to you or Amazon packages?
Yeah, I think it's unlikely, but there's a history of some infections very uncommonly being transmitted by mail. And what you don't know is who touched that and how long ago. So if it was somebody in the mail office and it was 5 minutes ago, bare hands or even a gloved hand touched your mail and you want to wipe it off, not a problem. I think the risk is very low. I really want to come back and say the big picture, hand washing, wearing masks in public.
So if we're thinking about masks, there's lots of products out there, and some of them are harder to get than others. I wonder if you could just sort of step us through some of the masks and what we know about some of the rationale for different kinds of masks, including everything up to the N95s we use in the hospital.
Yeah, it's a good question and timely. You and I spoke. There's an article that just came out recently talking about scientists who've looked into the materials themselves. And on the low end, in terms of protecting you and protecting the people around you, would be bandanas and scarves. They're okay if that's all you have, and I would say use it, if nothing else. Somewhere in the middle would be if you had sort of stacked up coffee filters. They seem to be moderately good in actually preventing droplets from going through. At the high end, there's some people who have studied this said, look, if you take the vacuum cleaner filters or the filters that are sometimes used for furnaces, or even a special type of those thick pajamas, that flannel pajamas that some people use, apparently that material is not porous enough, and so will be protective. So that's at the high end. And if that's what you have available, people are actually making masks out of these things, including the vacuum cleaner filters that I think are very reliable. Oh, and your second question was, what about in the hospital? Where do we wear the N95s and the regular surgical mask? With the information we have now today on the asymptomatic carriers, I assume they're patients on, I'll call them benign wards, non-COVID wards, who are carrying, we have no idea. So I would tell healthcare workers, anywhere you're in the hospital, whether you're in front of a patient or you're at a desk in the hospital, I would wear a mask. If you're doing procedures where you might get exposed to large and small droplets, I would put on the N95 mask. Because what you want to filter out is not only the large droplets, which we say are greater than 10 microns in diameter. That's a micron is a millionth of a meter. Anything greater that's considered a large droplet, and regular masks would probably stop that. However, the tiny droplets that come out and hang in the air, what I've called the microscopic hot air balloons encasing the virus, hang out for hours. And someone could cough or have a procedure, and then an hour later, somebody come in and inhale the microscopic hot air balloon. So if you're really close to a patient who's being suctioned, for example, who's having a trach done or having an endotracheal tube put in or pulled out, those people cough a lot. And again, probably a wider spectrum of particles. I'd wear an N95.
Okay. Yeah. Well, and I'll say it's amazing to see just the use of masks out in public. You've even seen people with N95s out in public. And then also the spectrum of people that are crafty and are making things at home. And so I think your point about, bandanas are sort of the low level, and flannel masks should be fairly good, because people probably can have access to that and make masks out of it. We're going to see people ripping up pajamas now to make masks, I think.
Well, my hat's off to people who stop whatever they're doing to make these masks for their neighbors, for their healthcare providers. Thanks to all. I think at the end of this, we'll have a lot to celebrate about individual decency and courage and commitment.
What about face shields? Because people have been talking a little bit more and more about the idea of having some sort of protective face covering.
Yeah, the positive part of a shield is one, you now avoid putting your fingers in your eye. If they itch, you can't do that with a shield. So that's one of the spots where the virus can land on the conjunctiva. The other be the nose and the mouth. So a mask covers 2 out of 3. A shield, all 3. And it keeps your hands away from that. So I think it's an additional benefit. And if I were to vote for the country, I would say all healthcare workers in all hospitals should wear a shield when certainly when they're dealing with patients. I think it's a real good move to make.
Yeah, I'm imagining it like those giant dog collars you get after your dog goes to the vet. So it's
well, it does work.
Yeah. And I think we now have at the hospital, people are being issued them. So that's great. I think you get one and you have to reuse it, but it's nice to sort of have that. What about if we have people coming into our home to do maintenance? Maybe they've got to fix the air conditioning, or maybe you've got a cleaning service that comes in. Should we still do that? Should we make those people wear masks? Should we leave when they come? How do we think about that?
Well, I would hold off on any contact possible. That's sort of a general statement. What you're trying to do is come in any contact, no closer than 6 feet, but maybe even longer than that, 10 or 12 feet or more, with anybody, because we know that an asymptomatic looking person could be carrying the virus. So first, I would say avoid any unnecessary contact with people. Assume the other person's infected. So if you have a person coming in to clean the house, I would say postpone it. A nice thing to do would be those people who work by the hour, pay them anyway for at least some of the times that they would come. And I've been encouraging people to do that, and that's what we do. As far as an emergency, something happens and you got to fix your air conditioner, something like that, think about it. But Then what I would try to do is ahead of time, here are the rules. I'm going to leave the door open, or you work outside. You send me the bill. I'm going to be outside where you're in, and try to be distant from you with all respect to both of us.
And would you let the house sort of settle for some period of time after they left to sort of have these droplets maybe dissipate?
Well, that's a hard question because we just know so little about that. What I think is a priority would help me answer that is if CDC or the public health, wherever, would come into hospitals first, where the density is real high, do air sampling. You shouldn't find it in the air if there are no droplets. But if you find 10, 20, 30% of your samples positive, that's a huge finding and of great import for control. At the same time, just to sort of control what was going on, I would try to do widespread sampling of the surfaces in hospitals where people touch things frequently, whether it's a doorknob or the side of a door, any kind of a desk top that we're using, maybe even the computer. Again, if we found 10% of samples, 20% of samples, that means we're not doing a very good job at disinfecting and then by having those two samples, we might be able to ask the question, how frequently is transmission by large droplets, by droplets, aerosols in the air, the tiny droplets, or by contamination of hard surfaces? We don't know that yet. That would help us really do a lot of the answering that you're seeking.
Yeah, it seems like we've been in a sort of crisis response mode for a while, and maybe now we're finally, I don't want to say that we have the epidemic under control because we're still worried about overcoming the capacity of hospitals and healthcare facilities generally. But it sounds like now we can start to be a little bit more strategic and really start to answer some of these unknown questions.
I hope we do. You're absolutely right. I mean, we have to turn our attention to learning something. And when you think of the past pandemics arriving at every 10-year interval or so, we still would have thought, well, what did we learn from, and you name your favorite one, MERS, SARS, H1N1 in 2009 and 10. Unfortunately, too little to help us today.
So let me wrap up with just asking you about one last thing. So you've been a big proponent of hand washing. I remember we had signs with your picture on them over all the sinks in the hospital saying, Dr. Wenzel says, wash your hands. A lot of people are also wearing gloves now. So what's your perspective on gloves versus, gloves plus hand washing or just hand washing?
Well, I think either one done perfectly is probably really good. Even with gloves on, if you touch a surface and touch your mouth or your nose or your eye, you're putting yourself at risk. Again, the shield looks pretty good to try to do that. Assiduous hand washing, really good. Again, if you use gloves and change them frequently, that probably is the step that would be very useful in protecting the next contact or yourself. So if you're going in to see a patient and you touch anything in that room, I would say come out, get another pair of gloves. That probably is going to help still do hand washing the way we always do when we use gloves in seeing patients.
Yeah, and I think I've seen people wearing gloves at Target and the grocery store and the sort of other places I had to go, the food pickup places. So, and I wonder how often they're changing their gloves. It's hard to say.
Well, I hope that they remind themselves, don't touch your face. Change your gloves when you're out of there. Then wash your hands. Don't touch anything else if possible.
Yeah, because it's not so much just the fact that the gloves are protecting your hand; they're trying to protect your mouth and your eyes. And your
That's
nose.
right, exactly.
Great. Well, it's always great talking to you. I always learn so much, and I hope that our listeners will also find this as edifying as I have.
Well, I've enjoyed it too, Alan. Thanks very much.